Hello, I'm Gordana Dermody, and I'm a senior lecturer at the University of the Sunshine Coast in Queensland, Australia. And me and my colleagues submitted our paper titled Interpretation of Health Smart Home Data and Implications for Clinical Decision Making, Inductive Content Analysis, and we submitted that paper to JMIR Nursing. And in this video, I'm going to briefly explain the purpose and findings of our JMIR nursing paper, which explores how nurses interpret health smart home data and what this means for clinical decision making. Health smart home technologies use sensors placed around the home to provide information about a person's activities of daily living around the home, so their routines, their waking, sleeping, making of coffees, toileting. And these systems are thought to help a person potentially age in place and also recognize changes in health early on, so have a forecasting mechanism with the idea that we can extend a person's aging in place in their own home for as long as possible. And this type of technology is definitely useful, but for it to be useful in a clinical sense, it's very important that nurses are able to understand the data and decide what's meaningful and what action they need to take. So basically the clinical decision that they might need to make. Until now, we've had very little evidence about how nurses actually interpret this kind of data. So what we wanted to do is to understand how nurses make sense of health smart home data when it's presented to them visually, and whether some types of data displays are easier to interpret than others. And rather than testing the technology itself, we focused on the human side of digital health, so basically the nurse's perspective when looking at different visualization types. So we invited a group of experienced registered nurses to take part in the study. And they were shown examples of real health smart home data presented as different graphs. And the graphs showed things like a person's activities of daily living, like sleep patterns, movement around the home, for example. And the nurses also had a little bit of a history and some background on each of the cases who were used in this, to represent the data. So it was these research participants' cases. And then we asked the nurses to look at the graphs and describe what they thought was happening and whether the information could help make clinical decisions. We also asked them which types of graphs they found easiest to understand. And most nurses were able to identify meaningful patterns in the data. For example, they noticed changes in activity levels, reduced movement, disrupted sleep, or changes in daily routines. And these kinds of patterns are very important because they could signal a change in a person's health and well-being. And the findings shows that the health smart home data can be clinically useful provided it's presented clearly and makes sense to the nurse who's viewing it. At the same time, nurses also described some uncertainty. Some graphs were difficult to interpret without more background information. For example, a change in sleep data could mean many different things depending on the person's health, their medication, or the recent events. And nurses emphasized to us that data without context could be misleading, and that understanding the person behind the data is really essential. So an important finding from this study was that the type of graph really does matter. Nurses consistently found line graphs and bar charts easier to understand than pie charts. Pie charts were rated as the least helpful for clinical interpretation. And while this may seem like a small design issue, it does have real consequences because if data are hard to read, they're less likely to be trusted or used in decision making. So our findings suggest that the success of health smart home technologies depends not just on sensors and algorithms, which are of course important, but also on how information is presented to nurses, because after all, they will need to be able to interpret what this means, and that data is going to be augmenting their clinical decision making. So it highlights the importance of involving nurses in technology design from the beginning, and using clear and familiar visual displays, and recognizing that interpretation takes time, skill, and also clinical judgment. So as more and more digital health technologies are introduced into everyday care, especially into home care, it's critical that we understand how clinicians, specifically nurses, actually use the information they're given. So our study shows that nurses play a central role in turning data into meaningful care decision, and that good design supports good care. Equally important is the reason why we submitted the paper to JMIR Nursing. We believe that nurse researchers are very important in conducting this kind of research because we are advocating for clinical data that is represented in such a way where nurses can interpret it so it actually helps the client or the patient as maximally as possible. So we call upon nurses around the world to join us in studying this phenomenon. And JMIR Nursing is the perfect place to submit these types of papers because JMIR is open access, and that's really beneficial because it allows researchers in countries who may not have access through their librarians and their libraries to access the papers. And in fact, even lay people, any nurse who's working can access it without having to go through a university library database. And we find that really, really valuable. So we hope that you enjoy the paper, and feel free to contact us via email if you would like. And we look forward to publishing many more papers in JMIR. Thank you so much for listening to this video.